So what do you do if you have symptoms? Well, let's kind of break it down into categories. Now, if you have really mild symptoms, mild meaning you have perhaps a low-grade fever and you have a little bit of a cough and some body aches and sort of you feel like you may have the flu, what you want to do is stay at home. The best thing to do is stay at home, take some Tylenol, take over-the-counter cold medications if appropriate, and try to isolate yourselves from your family. If you live with other family members, you want to wear a mask at home, wash your hands aggressively, and try to ride it out. You do want to get in touch with your doctor. It's never a bad idea, and depending on your situation, there may be a role for testing, even with mild symptoms, particularly if you're, for example, a healthcare worker. But by and large, mild symptoms, you're going to stay at home and let it ride out. Most of the time, at least in the current status of things in the United States with testing, you're probably not going to warrant testing if your symptoms are really mild. But assume you have it and treat yourself as such. Now, if you have moderate symptoms, so maybe you have a higher grade fever for several days, your cough is a little bit worse, and maybe even you have a little bit of trouble breathing, definitely in this situation, you want to call your doctor. That may be a situation where you do want to get testing done, again, depending on the situation of your area. What you don't want to do is head straight for the emergency room or head straight for your doctor's office or an urgent care center. The reason is, number one, they're completely overwhelmed and crowded with a lot of COVID-19 positive patients. So if you don't have the infection, you're going to expose yourself potentially to people who do. All right. Not to mention there are going to be really long waits and things are in sort of a disarray here. So do not go anywhere without calling your physician if your symptoms are moderate. Now, if your symptoms are severe, meaning you've developed chest discomfort or shortness of breath and difficulty breathing, particularly if the breathing has gotten worse over a short period of time, such as over the course of 24 hours, that's a situation where you want to call 911 and play it safe. Now, EMS is overwhelmed in a lot of places, particularly in New York City. I think they had 7,000 calls on Thursday alone, which was, I think, a record for them. So EMS is very inefficient right now, so you have to take that in mind. Another reason not to call if you only have mild or moderate symptoms. Let the EMS handle the people who are a lot sicker, okay? So again, if you're not sure and you're not feeling completely crummy, call your doctor and try to get some guidance.